Hello everyone. A very good morning to all of you. Am I visible? Am I audible to you guys? Give me a minute to confirm if I'm clearly visible, audible. I will start the lecture ahead. Yes, I guess it's working and I'm clearly visible, audible to you guys. Okay. So a very good morning to all of you. I welcome you all for today's session. I am Dr. Priyanka Sachdev here and today I'm going to start a new series of free classes, a fresh batch, a new series. So in this series, I'm going to continue with pharmacology. So I have covered many topics in pharmacology, but many students requested me to cover CNS pharmacology, which is a difficult portion in pharma. So here I am. In the next 3 days, I'm going to cover entire CNS pharmacology. So in this series, I am going to teach you the first topic, that is alcohols today. I'm starting with alcohols, poisoning, toxicity, everything about it, the various types of alcohols, its property, mechanism of action. So everything, how does it got prepared? The second topic which I'm going to today is sedatives and hypnotics. Sedatives and hypnotics, in which I'm going to cover the benzodiazepines, a very important barbiturates and benzodiazepines, a comparative analysis, very important topic. You can't afford missing it. So in the first half of the lecture, I'm going to cover alcohols, and immediately after that, I'm going to cover sedatives and hypnotics. After that, tomorrow also I'm going to cover two topics. Which two topics? I will start with anti-Parkinson's drug, and anti-epileptic drug. Anti-epileptic drug. After that, a day after tomorrow, I'm going to cover antipsychotic drugs, in which I'm going to cover antidepressants and anti-manic and anti-anxiety drugs, right? And after that, I am going to cover skeletal muscle relaxants. So neuromuscular blockers, tuberculin, so all the drugs, skeletal muscle relaxants, I'm going to cover there. And after that, I'm going to cover local anesthesia. So these all topics one by one, I'm going to take in the next 3-4 days, so that we will be able to cover entire central nervous system and peripheral nervous system in the pharmacology. I have already covered autonomic nervous system. The free lectures are available on the YouTube. You can watch it anytime. Shall we start? Everyone give me a thumbs up. Shall we start ahead? So let me start with CNS pharmacology. The first topic in CNS pharmacology, the alcohols. And immediately after that, today only we are going to cover sedatives and hypnotics. I want a thumbs up from you guys. Shall we start? I'm starting with alcohols. The first topic for today is alcohols in CNS pharmacology. So many students are preparing for their university exam for the pharmacology. They are in second prof and they are preparing for their university exam, and many students are preparing for the competitive exams, in which NEET PG, FMG, INICT, next they are preparing for MCQs. So the one who are in the second prof university exam, they require short answers and long answers of this topic, and the one who are preparing for competitive exams, they require MCQ, which are already asked in the previous year question papers from this topic. Right or wrong? Right. So this is the thing. And okay, so I will cover both. So from this topic, you can see these are the SAQs, LAQs, which are asked in the various university exams throughout the India. And let me finish the topic. In the end, I will show you MCQs, which are asked in previous year question papers from this topic. So let me start now. Right. So let me start with ethyl alcohol, methyl alcohol. There are two types of alcohol, ethyl alcohol and methyl alcohol. So first I will teach you ethyl alcohol, known as ethanol. After that, I will teach you methyl alcohol, known as methanol. Ethyl alcohol is used as a beverage. It is used as a beverage. It is used for drinking as a beverage in many countries. India is one of them. Methyl alcohol is not a beverage. It is used for industrial purpose. It is used for manufacture of many things. It is used for industrial purpose. So I will teach you the toxicity of both type of alcohols basically. So that is very important, from which many questions come in your exam. Let me start with ethyl alcohol or ethanol, right? So these are the headings under which we are going to cover any topic. So I will teach you the introduction, preparation, how does ethyl alcohol got prepared, the various types of alcohol beverages which are prepared from ethyl alcohol, pharmacological actions on various organs of human body, all organs, GIT, CNS, CVS, renal, urinary, all organs, right? Pharmacokinetics, interactions of ethyl alcohol, contraindications of ethyl alcohol. The most important is ethanol toxicity, the acute toxicity, the chronic toxicity. Everyone give me a thumbs up first. Everyone. Let me start with the introduction. You all know the formula of ethanol. It is C2H5OH. C2H5OH. We know, we have studied this in chemistry in our childhood. CH3CH2OH. So OH is the group, it is ethyl alcohol, right? Now it is having a hydrophilic moiety as well as lipophilic moiety. That's why the combination of the both, it is an amphipathic molecule. Ethyl alcohol have a hydrophilic as well as lipophilic both moieties. That's why it is amphiphilic molecule. How does it got prepared? Do you know how alcohol is prepared in an alcohol factory, in an alcohol industry? How does ethanol is prepared? Ethanol is basically prepared from starch. An enzyme act on the starch which is known as convertase, and it got converted into maltose, right? Okay, let me show you. So you can see, first we take starch, convertase act on it, and maltose is formed. Maltose is one of the sugar like glucose. It is maltose. The formula of maltose is same as that of glucose. You can see C6H12O6. So it is the formula. It is prepared from sugar oxidation. Sugar here, you can see it is the sugar, maltose, glucose. This is the sugar. Zymase act on it. So C6H12O6. So carbon dioxide and ethanol is formed. These are the two end products. These are the two products. You can see these are the two products. So it is carbon dioxide, gas is formed, and ethanol is formed. So these are the chemical reactions, not very important, but you must know how does it prepared in the industry. In the industry, basically it is prepared from the starch. Basically it is prepared from the starch. First we convert starch to maltose. It is one of the sugar, and then maltose, zymase act on it, and finally ethanol is formed, right? After that, let me teach you a step which is known as distillation. Very, very important. Once the alcohol is prepared, ethyl alcohol is prepared in the industry, it got distilled. What do you mean by distillation? What do you mean by distillation? Distillation means to purify the alcohol by vaporization and then condensation with cold. First we do the vaporization. And then we do the condensation. So vaporization followed by condensation. This is known as distillation. We are doing this to purify the alcohol. We are doing this. So once we make the alcohol in the industry, in the factory, then we distill it. When we distill it, in the distillation, first we vaporize it and then we condense it. This is done to purify the alcohol, right? You got it? Now the various types of alcoholic preparations you may be knowing. There are malted liquors, there are wines, and there are spirits. The various types of spirits are available in the market like beer, rum, gin, various types. I will tell you the concentration of alcohol in all of them. Let me start and let me teach you the difference between the three. So let me start with the first one. The various types of alcoholic preparations I am going to show you here. And the basic difference here is the concentration or the percentage of alcohol in each of them. So you have to learn the percentage or concentration of alcohol in various types of preparations. Let me show you the various types of preparations now. As I have told you, the first type is malted liquors. It is obtained simply by fermentation of cereals. It is undistilled. So here distillation is not done. We are not purifying. In Hindi it is known as desi. It is the pure form. Pure form means we are not pure exactly. You know, it is directly obtained by fermentation of the cereals. Right, the distillation process is not done here. Right, so here the concentration of alcohol is very low. It is only 3 to 6% because we are not evaporating it. In distillation, we do the evaporation, so gradually the concentration increases. In evaporation, the water vapors are evaporating and alcohol concentration increases. Right, but here we are not doing distillation. That's why we are not doing evaporation. So concentration of alcohol is not increasing. It is very low, only 3 to 6%. Beers come here. Beers and stout come here. So beer is the beverage in which there is lowest alcoholic concentration. Beer and stout both have lowest alcoholic concentration. They are undistilled. That's why the taste of beer is somewhat different as compared to wine and other liquids. Have you got it? Give me a thumbs up. Give me a thumbs up if you got it. So that is the malted liquids. After that, the second thing is the wines. Wines are prepared from grapes. Malted liquids are prepared from cereals. Cereals contain the various types of sugars. From those sugars we are preparing it, right? Grapes or other fruits also contain sugars, and we are preparing it from the fruit, you know, from one of the fruit, basically from grapes, and other fruits are also there, but basically from, and it is also undistilled. ये भी undistilled है, ये भी undistilled है. The main difference, malted liquors, that is beer, is prepared from starch, from the cereals, right? And wines are prepared from the grapes, from the fruit, not from the cereals. Here alcohol concentration is 16 to 22%. So it is here, compare. So here alcohol concentration was only 3 to 6. Here it is 16 to 22. So compare beer versus wine. Beer and stout versus wine. Give me a thumbs up. Give me a thumbs up. The third type are the spirits. These are the distilled version. Here we are doing the distillation. So see the concentration of alcohol. It is the highest. It is 40 to 55. यहाँ पे 16 to 22 था. यहाँ पे 3 to 6 था. Now it is 40 to 55. What does spirits mean? Spirit mean it can be rum, it can be gin, it can be whiskey, it can be brandy, it can be vodka, it can be others. So you know the various forms. So in all these, rum, gin, whiskey, brandy, vodka, the concentration of alcohol is the highest. So beer mein concentration is lowest. After that, wine, and after that, all these spirits. So that is according to the concentration. So let me summarize the various preparations of the alcohol. In सब पे MCQ है हाँ. It is for your general knowledge also and but for MCQ purpose also. The various alcoholic preparations. The various alcoholic preparations are of 3 types. What are the 3 types of various alcoholic preparations? So the first one you can see here, malted liquors. The first one are the malted liquors. The second are the wines and the third are the spirits. So the various type of preparations are malted liquors, second are wines, and third are spirits. Can you tell me the examples of each of them? Malted liquors contain beer and stout. Beer and stout. Wines contain only wines, the various types of wines. Spirits contain, it can be vodka, it can be gin, it can be whiskey, it can be brandy, it can be the various preparations you may be knowing, right? So all these spirits are spirits, right? Now tell me the concentration of alcohol in each of them. Here the concentration of alcohol is only 3 to 6%. Here the concentration of alcohol is 16 to 22%. And here the concentration of alcohol is 40 to 45%. So you have to learn the concentration of alcohol is important and the various type of preparations of the alcohol. Right, now tell me the difference between them. What is the basic difference between them? The basic difference between them, malted liquors, that is beer and stouts, they are prepared from cereals. Cereals, the starch, the glucose, the sugar present, maltose, not glucose, it is maltose present in the cereals, and it is undistilled. It is undistilled by fermentation of cereals, and it is undistilled. We are not distillating it. Wines are prepared from fruit. Which fruit? It is prepared from grapes. Grapes also contain sugar. So sugar का हम fermentation कर रहे हैं. Sugar, either sugar from the cereals or sugar from the grapes. So it is fermentation of the sugar. But sugar is present where? If the sugar is present in cereals, it is malted liquor. If the sugar is present in fruit, especially grapes, it is known as wine. It is also undistilled form. It is also undistilled. And spirits are the distilled form. They are distilled form. They are prepared from anything, but they are distilled. That's why they have the highest concentration. Everyone give me a good thumbs up. You got it? You got it, the various preparations. So that is a summary of the various type of preparations. Now let me teach you the next topic, the actions of the alcohol on various body organs. The actions of the alcohol on various. So I'm going to teach you the action of alcohols on these 10. Alcohol means ethanol. Ethanol, the various preparations of ethanol. It can be beer, it can be stout, it can be wine, it can be rum, whiskey, vodka, the various types of spirits, right? All these on 10 organs of the body, on 10 systems of the body. What is their local effect? What is the effect on brain, CNS? What is the effect on heart, blood vessels, CVS? What is the effect on blood? What is the effect on body temperature? What is the effect on respiration? What is the effect on liver? What is the effect on kidney? What is the effect on sexual function? What is the effect on pregnancy teratogenicity? So you have to tell me answers of everything. First, give me a thumbs up. Should I start? So these are the actions of ethanol on various body organs. I will tell you the actions on all these 10 organs one by one, and then in the end we will revise by filling this table. So in one word you have to tell me the action on all these organs. Should I start with local effects? Let me start with local effects. Let me start with local effects. You can see local effect. Now can you see this is tissue paper? This tissue paper is dipped. It is dipped in ethanol. It contains ethanol. It contains ethanol. So local effect on applying skin. When we apply alcohol on skin, it cools very rapidly by evaporation. It cools. It gives a cooling effect. So if you take the ethanol in a tissue paper and rub it on the skin, you will have a cooling effect. Why? Because it is very fast evaporating. Because of the fast evaporation, you will feel like a cooling effect. So it gives a cooling effect. That's why alcohol sponging can be used in fever. If the person have high grade fever, the child have high grade fever, we can take a cloth or a tissue paper, dip it in the alcohol, and we can do the sponging so that the child can get cooling effect. So that is the local effect, number one. Number two, rubbing on the skin produces redness and burning. So it, when we rub it on the skin, there is redness. There is redness in the skin and burning sensation in the skin. A little bit burning. So that's why it can be used as a counter irritant and rub efficient. What do you mean by counter irritant? Have you heard the word Jhandu balm? There is a balm. Most of our parents or grandparents are using it for their headache or their generalized pain. What is that? Balm kya hota hai? So it is not a pain reliever. It is not a painkiller. It produces burning sensation on the skin. So have you applied balm? I have applied it on my forehead or whenever I am having pain. So my mother used to apply. She believes that balm se pain kam hota hai. So whenever we apply the balm on our forehead or anywhere we have pain, it produces burning sensation. So basically your mind got diverted from the pain to the burning sensation. It is not a painkiller. So it is a counter irritant. It is diverting your mind from the pain to the burning sensation. So whenever you apply it, you feel like cooling effect and a burning sensation. तो pain से ध्यान हट के तुम्हारा ध्यान उस पे जाता है. So that is a counter irritant. Same thing can be done with alcohol also. Like balm, it also produces counter irritant. Give me a thumbs up. It causes precipitation of the proteins in the skin. That's why it is known as astringent effect, right? And it causes hardening of the skin. So hardening of the skin may prevention of sweating. It causes hardening and cleaning of the skin. So the pores, the sweat pores got they are closed, and that's why it is used for prevention of the sweating, right? So that is the thing. That is the thing. And yeah, the most important, the alcohols can be used for killing the bacteria in the skin, right? But not the spores, not the fungus, not the virus. It kills only bacteria. It kills only bacteria. So can we use alcohol as a sterilizer? As a sterilizer, yes, for killing bacteria it is a good sterilizer, but it do not kill the spores of the bacteria, it do not kill the fungus of the fungus, and it do not kill the viruses, right? Now 70% alcohol is the better sterilizer as compared to 90%, as compared to, so percentage wise 70% is better as compared to 90%. It is so, why so? Common sense say कि मैम 90% should be better now. If you use 90% of the alcohol, it should be better sterilizer. It should kill more bacteria as compared to 70. But no, this is not the case. If you use 70%, it is a better in killing bacteria as compared to 90%. Why? Can anyone tell me the reason of this? Why? Because more is the concentration of alcohol, more will be the evaporation. If you apply 90%, most of it will be evaporated, and in the skin it will not be available for killing the bacteria. In the hands, just suppose I am taking few drops of alcohol in the hands and rubbing it for sterilizing the hands, for killing the bacteria in my hands, right? For killing the bacteria in my hand. So if I use 90%, it got evaporated immediately and nothing is remaining here. But if I use 70%, it is somewhat in between. Some percentage is evaporated and some percentage will remain there. So 70% is better as compared to 90. Give me a thumbs up. Give me a thumbs up. So 70% is preferred over 90 or 100%. Since higher concentration get easily evaporated, not allowing the sufficient time for the contact and killing the bacteria. Give me a thumbs up. Everyone give me a thumbs up. So that was the local effect. After local effect, in local effect, we have seen many things. Number one, it got evaporated. Number two, it gives cooling effect. That's why used in fever. Number two, it gives burning sensation, so used as a counter irritant. Number three, it causes dehydration of the protein, precipitation of the protein. That's why it's astringent effect. And it causes prevention of the sweating. So these are the 1, 2, 3, 4 local effects. After that, it can be used as a sterilizer. But 70% is better than 90%. So these are the 5 points to be learned in local effect. After local effect, we should start central nervous system. The most important effect of alcohol on central nervous system. So it depresses central nervous system. Can you see? So basically it is depressing the central nervous system. Now, okay, but have you seen if a person drinks too much, he becomes too much talkative. He becomes too much talkative. He talks too much. He becomes hyperactive. Irrelevantly hyperactivity can be seen in the person if he is drinking. तो कहते हैं ना तो इसने तो बहुत drink कर लिया है. He's drunk. He's out. What do you mean by he's out? He's drunk. He becomes too talkative. He's talking irrelevantly. He's doing irrelevant action. He becomes hyperactive. But looking at these things, it sees that it is not depressing the CNS. Is it stimulating or is it depressing? Now my second question to you, is it depressing the CNS or is it stimulating the CNS? If you say, ma'am, it is depressing, why these actions occur? Why the person become hyperactive? Why the person become hyperactive, hyper talkative, more talkative? Why? I'm asking to you, why? Because in the brain, we have a center. It is known as inhibitory mechanism. In the brain, we have an inhibitory mechanism. What do you mean by inhibitory mechanism? In the inhibitory mechanism, there is a feeded background that what things we have to do publicly, what things we don't have to do publicly, what things we have to say in front of everything, what things we don't have to say. So that is feeded there in the inhibitory mechanism. So inhibitory mechanism prevents us from talking or doing those activity in public places that should not be done. But alcohol depresses the complete CNS. So it is depressing the inhibitory mechanism. So loss of inhibitory mechanism leads to over talkativity and over hyperactivity. Give me a thumbs up if you got it. Everyone give me a thumbs up if you got it. It depresses RAS also. That's why person feels sleepy after drinking. Sleepy. You know, RAS is for sleep. So person feel very sleepy. Give me a thumbs up. So it depresses. So basically it is depressing the CNS. Right. So it is depressing the inhibitory mechanism. So there is loss of inhibition. That's why persons enjoy social company. He talks freely, he speaks freely, he become overconfident, he start enjoying. He is known as great mimicker. That's why alcohol should be considered as great mimicker, right? So mood may swing from extreme happiness to extreme sadness. Person can be extremely happy, person can be extremely sad after drinking alcohol. So mood swings can be there. And but the loss of inhibition, the inhibition is lost because of depression of the CNS. The inhibition is lost. So now there is no inhibition. The person don't think I don't have to say this thing publicly. I don't have to do this thing publicly. He become overconfident. He talks too much. He speaks too much. He enjoys too much. So that's why alcohol is known as great mimicker. The effect on CNS is directly proportional to the concentration in the blood. More the person drink, more the concentration will be the blood, will go in the blood, and more will be depression of the CNS. तो जितना ज्यादा concentration blood में होगा, जितना ज्यादा वो drink करेगा, more the person is drinking, more it is going in blood, and more it is going in brain. So more it is causing depression of the CNS. So more will be the depression. It depends. It depends on the concentration in the blood. So there is a table you must know. So up to 20 milligram percent, 30 milligram percent, 50 milligram percent, more than 50 to 100 milligram percent, 100 milligram percent, 200 milligram percent, 300 milligram percent, and 400 milligram percent. This table is important not only in pharmacology but in forensic medicine also. So you have to learn this table. Up to 20 milligram, the person feels relaxed. If the person is drinking a small amount of alcohol, so he feel a little bit relaxed from the overall life, the hectic life, the tensions are gone. He feel relaxed. Number one. Up to 30 milligram, he feel relaxed, but excessive talking is there. He start speaking too much. He start talking too much. Up to 50 milligram, he is comfortable, he is satisfied, but yet in control. Abhi tak the person is controlled. He is talking too much, he become hyperactive, but yet in control. He will follow the commands. He will listen to you, right? More than 50 to 100, he become careless and free now. He become extremely careless. He don't care for anything. No social inhibitions, nothing. And he become free. More than 100, he become uncoordinated and slurring of speech. He can't talk clearly. Slurring of the speech. You know what slurring of speech? That is there, and he cannot walk. He cannot talk clearly. He cannot walk. He cannot walk, right? So ladkhada ke chalega wo. In 200 milligram, the person is known as drunk. He is intoxicated and extremely drunk, but still mobile. Still mobile with his own foot. Ladkhada ke chalega, but chalega. At 300, stupor. He is unconscious. He is unconscious. He is in stupor. He cannot talk. He cannot walk. He become unconscious. Up to 400, deadly drunk. The patient will go in coma, and finally death is there. So that is the poisoning. That is the toxicity. That is the poisoning. Give me a thumbs up. Give me a thumbs up. You should know this table completely. Everyone give me a thumbs up. So this is the table you should know, right? So that is the complete table. At what concentration of alcohol? This is the concentration of alcohol present in blood. So at what concentration, what is happening? This table you must know. Everyone give me a thumbs up first. What is hangover? You may be knowing the word hangover. So hangover is the next morning. After sleeping, next morning, the person have withdrawal symptoms. Person have headache, dry mouth, laziness, disturbed mood, impaired performance. That is the next morning. That is known as hangover, right? Now, alcohol has one more thing in the CNS. Alcohol initially exerts an anticonvulsant action. That is not important. It lowers the threshold of epilepsy. It lowers the threshold for seizures. So if a person, if an epileptic person, if a known case of epileptic person drinks too much of alcohol, scissors can be precipitated. In him, the scissors can be precipitated. So that is the effect on CNS. Can anyone tell me what is the effect on CNS? If you ask me in one word, what does it do on CNS? So my answer is depression. It depresses the CNS. It depresses complete CNS. So it depresses RAS also. That's why the person feels sleepy. It depresses cortex also. And so various actions are inhibited. It depresses inhibitory mechanism, inhibitory center, inhibitory mechanism. So loss of inhibition is there. That's why the person become too much talkative, too much active, and careless free. That's why alcohol is known as great mimicker. After that, we have seen the various concentrations starting from 20 milligram, 30 milligram, 50 milligram, 100 milligram, 200, 300, 400. At what concentration, what is happening? So we have seen this table, at what concentration, what is happening. We have seen this complete table, right? And so these are the basic actions. Yeah, and one more action on the seizures. So it decreases the threshold for seizures. So that's why it can precipitate the seizures in an epileptic person. So we have seen the actions on the CNS, right? The third point, what is the action on CVS? What is the action of the on the heart and the blood vessels? What is the action on the heart and in blood vessels? In small doses, no effect on BP. But in moderate and large doses, rise in BP. It causes hypertension. It causes rise in BP because of stimulation of the sympathetic system. Give me a thumbs up if you got it. Give me a thumbs up. In large, okay. Small doses, moderate doses, large doses. Small doses में अलग action है, moderate doses में अलग है, large doses में अलग है, large में. Small doses में no effect on BP, moderate doses में hypertension, rise in BP, but large doses में fall in BP, hypotension. So in large doses it causes fall in BP. So it is known as, because of fall in BP, it can lead to atrial fibrillation. It is known as holiday heart. So whenever a person goes on holiday, he drinks too much of alcohol. So fall in BP can occur and various complications can occur. So that is the effect on CVS. CVS पे बहुत simple action है. In CVS, small doses, moderate doses, large doses. Small doses, moderate doses, and large doses. In small doses, no action on BP, no change in BP. Moderate doses, increase in BP, and large doses fall in BP. This is known as holiday heart. Give me a thumbs up. Give me a thumbs up. What is the action on blood? What is the action on blood? So in the blood, it increases good cholesterol and it decreases bad cholesterol. You know, HDL is good cholesterol and LDL is bad cholesterol. So it is doing good for the lipid profile. It is doing good since it is increasing the good cholesterol, which is protective for coronary artery disease, and it is decreasing the bad cholesterol, which is a risk factor for the coronary artery disease. It is decreasing so it is lowering the effect of coronary artery disease. So what I am saying, am I saying that drinking alcohol is good for heart? Drinking alcohol is a protective action for coronary artery disease? Yes. The answer is yes. So only good thing in the alcohol is that if someone is drinking small amount of alcohol daily, nearly 2 to 3 drinks daily, so less than 3 drinks. If someone is drinking less than 3 drinks, it is giving a protective action. It is giving a protective action. So you say, ma'am, it is a good thing. We will start drinking from today. I'm not a drinker, but you have told us a good point. So why don't we drink every day? Why don't we drink every day? So I know something is good in the alcohol, but good thing is only one. This one is the only good point. The rest, all the points are bad. It is causing more harm as compared to good. I know it is causing good also, but good it is causing only 1%. The remaining 90%, 99% it is causing harm. So harm is more. So if we see the risk benefit ratio, so risk is more as compared to benefit. I agree, benefit is also there. It is not the thing that there is no benefit. Benefit is also there, but it is not the thing that only benefit is there and benefit is more. No, risk is more. So it is causing more harm as compared to good. So, but the good thing which the alcohol causes is the lipid profile. It alters lipid profile in a good manner. So it increases HDL, which is a good cholesterol, and it gives protective action for the coronary artery disease. It decreases LDL, which is a bad cholesterol. So it decreases the risk factor for coronary artery disease. So if someone is drinking less than 3 drinks, it is giving a protection or lower incidence of coronary artery disease, right? But as I've told you, it is not the thing. Considering this point, non-drinkers should start drinking nowadays. No, this is not the thing, because the adverse effects are more as compared to this good thing. It will nullify this benefit. So only one benefit is there, but other adverse effects are more. Give me a thumbs up at least on this point if you got it. Give me a thumbs up on this point. Coming to the next point, body temperature. What does alcohol do to the body temperature? Alcohol is reputed to combat with the cold, so it gives a sense of warmness in the body. So in cold temperature, in winters, people used to drink brandy, people used to drink the alcohol, the various preparations of the alcohol, vodka, brandy, beer, whiskey, rum. So it gives a sense of warmness. So that's why it is more consumed during winters. Why it is giving the sense of warmness? Because it causes cutaneous vasodilation. The blood vessels of the skin got dilated. That's why more blood in the skin, so it is giving a sense of warmness there, a sense of warmness in the skin. So that is about the body temperature. Coming on the respiration, initially it stimulates the respiratory reflex, and later on it depresses. So final one, it is depressing. It is depressing the respiration. That can be the cause of death in too much drinking. If someone is drinking too much of alcohol, ultimately the person will go in coma at more than 400 milligram and person will die because of depression of the respiratory center in the brain. So it is causing respiratory center depression in the brain. The person cannot respire. Initially, because it irritates the pharyngeal and buccal mucosa. So there is a reflex. It will stimulate the respiratory reflex. So when the person start drinking alcohol, initially the respiratory rate increases, but later on it will decrease, and ultimately it can cause death also. So that is the effect on respiration. What is the effect on liver? We all know the effect on liver. Gradually, the alcohol causes cirrhosis in the liver. Cirrhosis is an end stage disease. There is no treatment of cirrhosis. Only treatment is liver transplant. So we have heard about alcoholic cirrhosis. The alcohol causes accumulation of fats and proteins in the liver. So accumulation of fat in the liver is fatty alcohol, which gradually leads to cirrhosis. It will cause injury to the hepatocytes and it will lead to cirrhosis. Actually, alcohol C2H5OH, right? It will get converted into acetaldehyde first, acetaldehyde, and acetaldehyde get converted into CO2 and H2 in the human body. So it is not the alcohol which is toxic to the liver. It is acetaldehyde which is causing damage to the hepatocyte. Again, a very important MCQ. So in the alcohol, it got converted into acetaldehyde in the liver, and this acetaldehyde causes damage to the hepatocytes. That is, it will cause cirrhosis of the liver. So we know the effect on the liver. So alcohol got converted to acetaldehyde. You can see alcohol get converted to acetaldehyde. Acetaldehyde get converted to acetate, and it will get converted to CO2 and H2O. So two enzymes are required. The first enzyme for conversion of alcohol to acetaldehyde is alcohol dehydrogenase, and for the conversion of acetaldehyde to acetate, acetaldehyde dehydrogenase. So these two enzymes are present inside hepatocyte, the liver cell. Inside the hepatocyte, we have abundant of alcohol dehydrogenase, but acetaldehyde dehydrogenase is limited. It is limited. So imagine if some person is drinking a small amount of alcohol every day, one drink, only one drink or two drinks every day, small amount of alcohol. So there is no harm in that, right? So both enzymes will suffice, and whatever the person is drinking ultimately get converted into CO2 and H2O. There is no damage to the liver. But if the person is drinking large amount of alcohol, the first enzyme is too much. It is sufficing, but the second enzyme is limited. So all the alcohol get converted into acetaldehyde. But since acetaldehyde concentration is more and the second enzyme is limited, so acetaldehyde cannot be converted again to CO2 and H2. So acetaldehyde will cause damage to the liver and it will lead to cirrhosis of the liver. The next is the kidney. What is the action of alcohol on the kidney? Can anyone tell me the action of the alcohol on the kidney? Can anyone tell me? So it is diuresis. It is diuresis. When a person drink alcohol, after that he has more urination. That is known as diuresis. Because what is the reason? Alcohol cause inhibition of ADH secretion in the posterior pituitary. So ADH is not acting. What does ADH cause? It causes sodium water retention. So there is no sodium water retention because of inhibition of ADH, and it will lead to diuresis. So what does alcohol causing? Alcohol or ethanol causing inhibition of ADH from the pituitary. Inhibition of ADH. No ADH means no sodium and water retention. Normally ADH causes sodium water retention, but no ADH means no sodium water retention. No sodium water retention means all the sodium and water is excreted in urine and person have more urine. That is known as diuresis. This is how alcohol leads to diuresis. You should know the mechanism of everything, right? So that is the action of alcohol on kidney. What is the action of alcohol on sexual performance of a person? After drinking the alcohol, the person feel aphrodisiac. What do you mean by aphrodisiac? What do you mean by the word aphrodisiac? Means it is a substance which increases the sex drive. So person have more sex drive after drinking the alcohol because of the loss of inhibition. The inhibitory center in the brain got lost. So that's why the person have more sex drive, right? And it provokes the desire in the person for performing sex, but it takes away the performance. The person cannot do the performance, right? But the desire is increased. So that is the action on sexual function, right? Have you got it? Have you got it? Teratogenicity. What is the action of alcohol on a pregnant lady? If a pregnant lady consumes alcohol during pregnancy, it can cause harm to the fetus. What does the fetus will have? Fetus will have all these things. The fetal will have mental retardation inside the uterus of the mother. Imagine, she is a pregnant lady. This is the uterus. This is the uterus. And this is the fetus inside the uterus. This is the fetus. If this lady is consuming too much alcohol during pregnancy or even a small amount of alcohol during the pregnancy, this fetus will have mental retardation. This fetus will have slow growth. It will have small brain. The brain of the fetus cannot develop. It is microencephalopathy. The facial abnormalities are there, malformations are there, and increased risk of infections is there. So this fetus is having a syndrome known as fetal alcohol syndrome. Fetal alcohol syndrome, which is a combination of all these things. That's why alcohol is contraindicated in pregnancy, because it is teratogenic. It is causing a syndrome in the fetus. The name of the syndrome is fetal alcohol syndrome. And these are the symptoms of that syndrome. Give me a thumbs up. You can see here, fetal alcohol syndrome, right? You can see the various facial abnormalities, low nasal bridge. Can you see the nasal bridge is low? Minor ear abnormalities are there, facial abnormalities. Indistinct philtrum is there. Micrognathia is there. The jaw is very small. The upper jaw is very small, right? Epicanthic folds are there. You can see here, epicanthic folds are there. Short palpebral fissure, thin upper lip. Upper lip is very thin. So these are the facial abnormalities. The various facial, I have told you, na? The various facial. So what are the facial abnormalities? So this is a typical face of a child whose mother have consumed alcohol during the pregnancy. So that is fetal alcohol syndrome. Along with it, the brain inside the child is very small. It is not developed and the growth of the child is very slow. So this is fetal alcohol syndrome. Give me a thumbs up. I am done. You have to help me for filling this table. You all have to help me for filling this table. Now, this is the summary. This is the revision. I have told you the effect of alcohol on all these organs. So that is the action of alcohol on all these organs. You have to tell me one by one. Who will help me? Pratyaksha, Nitya, Lavanya, or anyone else who is listening to me can answer. What are the local effects? What is the effect on central nervous system, cardiovascular system, blood, body temperature, respiration, liver, kidney, sexual function, and teratogenicity? So you have to tell me one by one. Let me start with the local action. What is the action of alcohol on local effect? Local effect means skin, in skin. So alcohol gave a cooling effect on the skin because of evaporation. That's why it is used for sponging during fever. Sponging in child during fever. That is the number 1 point in local effect. Local effect में पहला point ये है. दूसरा, it is used as a sterilizer. It can be used as a sterilizer, but 70% is better than 90% for sterilizing. It kills only bacteria, not the virus, not the fungus, not the spores. We have seen that in sterilization, right? Apart from it, it causes precipitation of the protein also. It gives counter irritant action also, so can be used for the pain. So these are the actions of alcohol on the local effect. Give me a thumbs up. Everyone give me a thumbs up. So skin pain, these are the actions of alcohol. Who will tell me the action of alcohol on brain? On brain. So basically it is stimulating a brain or depressing the brain. It is stimulating the central nervous system or depressing. I'm asking to you. Pratyaksha, Nitya, Lavanya, others who are listening to me. Can anyone of you answer? What is the action of alcohol on central nervous system? Yes, very good. Vodka, very good. So correct answer, it depresses CNS. So vodka, yes, Pratyaksha, very good. So my question to you, vodka, Pratyaksha, who are saying the answer is depression. Why the person become too much talkative and become hyperactive after drinking alcohol? If it is depressing the CNS, my common sense says that if it is depressing the CNS, the person should become less talkative, less active now. But on the contrary, the person become hyper talkative. He talks too much and he does the unnecessary things. Why? Salvation, why? Yes, 70% better than 90. Yes, I got this point, Salvation. But tell me the reason why person become too much talkative and hyperactive. Yes, Lavanya, the answer is CNS inhibition. It goes in the CNS is causing depression of the CNS inhibitory mechanism. Inhibitory, you know, ulte ka ulta sulta. Have you heard this proverb? So ulte ka ulta sulta. We all have an inhibitory center, inhibitory mechanism in our brain. So in all normal human beings, in me, in you, in everyone, we have an inhibitory mechanism in our brain. With that inhibitory mechanism, I am inhibited. What I don't have to do social places, at public places, at social places, in front of others. These are a list of things I don't have to do. These are bad things and I don't have to do in front of everyone. So that is my inhibitory center in the brain that is giving this command. But imagine if I'm drinking alcohol, so that inhibitory center is lost because the alcohol is causing depression of entire CNS. So alcohol is causing depression of that inhibitory center also. So inhibitory center is lost, loss of inhibition. Now person don't feel any inhibition. So he talks anything in front of everyone. He does anything in front of everyone, whether these things are acceptable at public places or non-acceptable. So that is loss of inhibition. You got my point? So that is the important thing. In CNS, I have told you the various concentration. If someone is drinking 20 milligram percent of alcohol, what will happen? So person is relaxed. At 30 milligram, he is relaxed, but he become over talkative. At 50 milligram, he is relaxed, but still under control, coordinated. At 100 milligram, the speech becomes slurred and he cannot walk clearly. Lad khada ke chalega. At 200 milligram, still mobile, but not under control. He has lost his control. At 300, he become unconscious. He becomes stupid. And at 400, he is in coma and death is there. So that is the various concentrations you should know, right? What is the effect of alcohol on epilepsy, on seizures? What is the effect on of alcohol on seizures, on epilepsy? I have told you, I'm asking to you. I'm asking to you. So it decreases the threshold of seizures. That's why it precipitates seizures. So epileptic persons do not drink, should not drink alcohol. If an epileptic person, known case of epilepsy, drinking alcohol, the seizures can be precipitated because alcohol in the brain decreases the threshold for seizures. So that is the action on CNS. Very good, Pratyaksha. That is the action on CNS. Let me teach you what is the action on CVS. Who will tell me the action of CVS? So in the CVS, I have told you 3 different doses. What is the, if low dose, what is the action on blood pressure? On moderate dose, what is the action on blood pressure? On high dose, what is the action on blood pressure? On low dose, there is no action on blood pressure, no change in blood pressure. On moderate dose, it causes increase in blood pressure, hypertension. And at high doses, on the contrary, it causes decrease in blood pressure, that is hypotension. So that is known as holiday heart. So that is the action on CVS. What is the action on blood? Who will tell me? So among the 10 action, only one good action is on the blood lipid profile. So it increases the good cholesterol, HDL in the blood, and it decreases the bad cholesterol, LDL in the blood. So it is causing good cholesterol को बढ़ा रहा है, the protective one, और bad cholesterol को कम कर रहा है, right? So overall, it is decreasing the risk of coronary artery disease. I know this is a good thing, but the rest 9 things are bad. So out of the 10, 9 things are bad. Only one thing is good. So risk benefit ratio may the risk is more, benefit is less. So it is not the thing if you are drinking, you will start drinking alcohol today. That ma'am told us it is good for heart. It is good for coronary artery disease. So I am having a risk of coronary. So from today I will drink alcohol. No, it is not the case. Listen, the rest of the 9 things are bad. The rest of the 9 things are bad. Have you got it? So only one good thing is the lipid profile. It is shifting the lipid profile towards a good end. So that is the thing. What is the effect on body temperature? Body temperature का क्या करेगा? What is the effect on body temperature? It gives a sense of warmth. That's why person drink more alcohol during winters, right? Why it is giving a sense of warmth? Because it causes vasodilation of the cutaneous blood vessels. In the cutaneous skin blood vessel, they got vasodilated. So more blood in the skin, more blood, more heat in the skin. So person feel warm. Yes, vote को. Very good. What is the effect on respiration? Respiration पे क्या effect है? What is the effect on respiration? So initially it stimulates respiratory center, but later on finally it depresses respiratory center. That can cause the death also. In liver, the action is cirrhosis. It causes cirrhosis in the liver. We all know that it causes cirrhosis in the liver. How does it causes? I have told you the exact mechanism also. Alcohol is not causing cirrhosis. Alcohol got converted into acetaldehyde. Acetaldehyde is toxic for liver, which is causing cirrhosis. It is an important MCQ. Please learn. It is the acetaldehyde which is causing cirrhosis, right? What is the action on kidney? In the kidney, it causes diuresis. So after drinking alcohol, person have more urination. Why the person have more urination? Why the person have diuresis? Because it inhibits ADH from the pituitary. No ADH, no sodium water retention. No sodium water retention, more sodium and water excreted in urine. So person have more urine. The person have diuresis. After drinking alcohol, person uses the washroom again and again. So person have diuresis after drinking alcohol, right? Yes, very good, Lavanya. Coming on sexual function. What is the action of alcohol on sexual function of a person? So it increases the drive, sexual drive, but it decreases the performance. It decreases, you got my point. It is the decreasing the performance. Person cannot do the erection and ejaculation, so performance is less. But the drive, the feeling of having sex is more. So the drive from inside will increase, but the performance, that is ejaculation, erection and ejaculation, the performance is decreased. The person cannot do the performance. That is the thing. So coming on the last point, teratogenicity. What will happen? What will happen if a pregnant lady consumes alcohol? What is the effect on the fetus? Is it good for fetus or bad for fetus? It is bad for fetus. It causes a syndrome in the fetus which is known as fetal alcoholic syndrome. Yes, Chandrasekhar. Fetal alcoholic syndrome. So Chandrasekhar, what are the various symptoms in fetal alcoholic syndrome? Fetal alcoholic syndrome में क्या क्या होता है? Can you enumerate? The brain of the child is less developed. It is known as microencephaly. The growth of the child is less. It is known as IUGR. There is increased risk of infection and there are various facial changes. I have enumerated the various facial changes. So complete thing is known as fetal alcoholic syndrome. Give me a thumbs up. So that is the summary of alcohol on various organs, various systems which are important in the human body. Yes, Chandrasekhar, microencephaly is the most important thing. The brain of the child is less developed. That's why any pregnant lady should not consume alcohol, even a small amount of alcohol during the entire pregnancy, during the entire gestational period. If the lady is doing so, she is causing teratogenicity to her child, to her fetus. So that should not be done. Give me a thumbs up. Everyone, those who are listening to me, give me a thumbs up. So that is the summary of alcohol, the effect of alcohol on ethanol on various organs. Let me come on the pharmacokinetics. Pharmacokinetics, alcohol got absorbed basically in the intestine. Stomach it is low absorbed, but intestine is very fast absorbed. After drinking, just suppose at 10 o'clock you are drinking alcohol. So maximum concentration in the blood is at 10:30. In half an hour, it will reach the blood and causing maximum, the peak levels. So after half an hour, the person have peak level. At what time you are drinking? Exactly half hour ke baad, after drinking the alcohol, the person have peak levels in the blood. The peak levels in the blood, right? Whatever alcohol the person is consuming, the alcohol will go in the liver. It will go. So just suppose the person is drinking the alcohol, it will go in the mouth, it will go in esophagus, it will go in stomach, it will go in intestine. From intestine, it will absorb, it will go in blood. From blood, it will go to the liver. It will go to the all organs, but it will go in liver. In liver, there are two enzymes. So first enzyme convert alcohol to acetaldehyde and second enzyme convert acetaldehyde to acetate and ultimately it will convert into CO2 and H2O. CO2 is expired out in inspiration, expiration. Expiration में बाहर चला जाएगा. H2O will go in urine. H2O will go in urine. You will say, ma'am, yo, wow, it's a good thing. Yeah, it is zero order. Very good, Botko. I will come on that point also. It follows zero order. So, but these are the end products when you consume small amount of alcohol, right? The first enzyme, alcohol dehydrogenase, is unlimited inside the liver, unlimited. But the second enzyme, aldehyde dehydrogenase, is limited. It is not unlimited, it is limited. So if the person is consuming small amount of alcohol, both the enzymes will suffice and ultimately these two are the end product. Nothing will remain in the body, everything will go out. But if the person is consuming large amount of alcohol, the first enzyme is still sufficient because it is unlimited, but second enzyme is limited. So second enzyme is not there. So all the alcohol got converted into acetaldehyde, but acetaldehyde cannot be converted into acetate, CO2 and H2O. So alcohol will be trapped in the form of acetaldehyde in a liver cell, in a hepatocyte. And this acetaldehyde is toxic for the liver cell. It will cause damage to the liver cell. That's why it will lead to cirrhosis. This is the mechanism, right? Now I will tell you alcohol toxicity, right? In the next hour, I'm going to teach you the alcohol toxicity, acute toxicity, chronic toxicity. Now, you may have seen in parties, right? Especially in the parties of the youngsters, sometime a young boy, 20-year, 19-year, 18-year boy, drink too much alcohol, too much. So that is the acute toxicity. So what are the symptoms? How does he feel like? So the friends are bringing the other friends are bringing the friend who has drunken too much to the hospital, and I am the doctor there. So what treatment I will offer? What treatment? So what is the treatment of acute toxicity? Right? And if there is a person, a middle-aged person, 45-year-old, he is drinking alcohol from last 25 years. From last 25 years, he is drinking a small amount of alcohol every day, two packs every day at night. So he is a chronic drinker. So what are his symptoms? उसके क्या symptoms होंगे? And I'm a doctor. So the wife is bringing the husband to the doctor. Doctor, please, he's a chronic drinker. These are the symptoms. Get treated. Please give the treatment to my husband. So what treatment I will offer to this man? So there are two scenarios in front of me. There is a young boy, there is a youngster, 15, 20-year-old boy. He's an acute case, acute toxicity of the alcohol. So treatment is different. And there is a middle-aged man. He's a chronic drinker, drinking alcohol from last 20, 30 years. A small amount, not too much at one time, daily small amount. So he's a chronic drinker. So symptoms of both of them differs. Treatment of both of them differs. Give me a thumbs up. I will come. Yes, Pratiksha, I will come on that also. Don't worry. So I will teach you all the treatment. You should know this metabolism of the alcohol. For giving the treatment, you should know this metabolism. Yes, alcohol follows zero order kinetics, as Vodke told us. It's good. You have told us. So I will tell you the other drugs also which follows zero order kinetics. I will come on the interactions also, but the link is expiring. So I have to end this lecture and rejoin the lecture again. I'm continuing lecture right now. Don't worry, don't go anywhere. I'm ending this lecture and starting the next one since this link is expiring. So thank you very much for listening me for this lecture, giving your precious time. Don't forget to write your feedback in the comment box. If you like, please click on the like button before leaving, and please share the link with your friends. Next class is right now just after 3 minutes. Next class is right now just after 3 minutes. It is also a free class. Like this, it is a free class. It is not on YouTube. It is on Unacademy Learners app. So all the students who are listening to me, I request them to join me on Unacademy Learners app. I guess everyone have this app. If someone is not having this app, please install from the Play Store. Go to the NEET PG category, and in the NEET PG category, you will see me live after 3 minutes at sharp 10 o'clock. At sharp 10 o'clock, I will be live. So I will take alcohol part 2 there. Alcohol part 2 there. Episode number 2, and immediately after that I will start sedatives and hypnotics. So the next 15-20 minutes I will finish alcohol, and in the next 40 minutes I'm going to teach you sedatives and hypnotics, barbiturates and benzodiazepines there. So don't miss my next lecture. Those who are newcomers on the Unacademy app, they will require a code for joining this free lecture. The code is my surname Sachdev, Sachdev. Note down, Sachdev, Sachdev 10. Sachdev 10 is the code. Please note down the code. Please come on the app, use this code and watch my free lecture there. Thank you very much for being with me. And I have already told you the code. It is Sachdev 10. It is the code, right? And yeah, MBBS Prof 1 is already out. So you can take the subscription for exclusively Prof 1, or you can inform your juniors. On Unacademy, we have two types of paid subscription, Plus and Iconic. Once you take the subscription, you will be eligible for all these batches by the topmost educators in India. These are the various plans available with us. In Plus, these are the plan where you will get only Unacademy lectures. In Iconic, these are the plan where along with Unacademy, we will provide you prep ladder access also. In the light subscriptions, these are the plans in which we will provide you only test series. Whatever comfortable to you, whatever your choice, requirement, whatever is your wish, take that subscription if you want to take subscription. So you can notice the price of all of them. Longer the subscription, cheaper it is. So go for a longer subscription, 4 year, 3 year. If you're a first prof, second prof student, it will be more cost effective to you per month wise, right? But if you want to give a trial, as small as 2 months subscription is also available, right? So you can take any subscription of your choice, right? Whatever subscription you are taking, before payment, apply my code, the same code, Sachdev10. You will get straightforward 10% authentic discount from the team. So please use this code if you want to get discount on the paid subscription. Thank you very much for being with me. I want everyone to join me on the app. Bye-bye. I'm ending this lecture and joining on the app. Bye.